Welcome back. Today we're covering 3 accessible core strengthening exercises for adults over 60, knee-to-chest marches, mini crunches, and modified planks. Core strength is essential for balance, posture, and functional independence. According to the Centers for Disease Control and Prevention, falls are a leading cause of injury among adults over 65, and maintaining core strength can significantly reduce fall risk. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises. Understanding core strength and aging. Your core consists of the abdominal muscles, lower back muscles, and hip muscles that work together to stabilize your spine and pelvis. These muscles are engaged in nearly every movement, standing from a chair, reaching for objects, walking, maintaining balance, and preventing falls. After age 60, core muscles naturally weaken without targeted exercise. This contributes to poor posture, increasing the risk of back pain, reduced balance and stability, and greater fall risk. However, research shows that core strengthening exercises can help maintain and even improve these functions at any age. The key is choosing appropriate exercises and practicing them consistently. The 3 exercises we'll cover today are low impact, require minimal or no equipment, can be modified for various mobility levels, and directly support daily functional activities. Let's begin. Exercise 1, knee-to-chest marches. The first exercise is knee-to-chest marching, which strengthens your lower abdominal muscles and hip flexors while improving hip mobility and control. This movement can be performed seated in a sturdy chair, standing with support if you have good balance, or lying on your back if floor exercises are comfortable for you. We'll focus on the seated version, as it's the most accessible starting point. Here's how to perform seated knee-to-chest marches. Sit tall in a sturdy chair with your feet flat on the floor. Your back should be straight but not rigid, maintain natural spinal curves. Place your hands on the sides of the chair seat or on your thighs for support. Slowly lift your right knee toward your chest as high as comfortable. You don't need to reach your chest, lift to a comfortable height. Pause briefly at the top, then slowly lower your foot back to the floor with control. Repeat with your left knee. That's 1 complete cycle. Continue alternating legs for 8 to 12 repetitions per leg. Move slowly and deliberately, this isn't about speed. Rest for 30 to 60 seconds, then perform a second set if comfortable. Key form points: maintain upright posture throughout, don't slouch or round your back. Lift with control, not momentum. Breathe naturally, don't hold your breath. And keep your core gently engaged by pulling your belly button slightly toward your spine. Modifications: if lifting your knee is difficult, lift your foot just an inch or 2 off the floor. Any lift engages the muscles. If you need more support, hold the chair sides firmly. And if seated exercise is too easy, try the standing version while holding a counter for balance. What this exercise does, it strengthens your hip flexors, which lift your leg during walking. It engages your lower abdominal muscles to stabilize your pelvis. And it improves hip mobility and coordination. Functionally, this supports walking with better leg lift, preventing trips and stumbles, climbing stairs more easily, and getting in and out of vehicles. Safety considerations: this exercise is generally very safe when performed seated. However, approach with caution if you have severe hip arthritis or recent hip surgery. Consult your doctor first. If you experience sharp pain in your hip or groin, stop and seek guidance. What to realistically expect: with practice 3 to 4 times per week over 4 to 6 weeks, you may notice walking feels smoother with better leg control, less effort when climbing stairs, and improved hip flexibility during daily movements. What you should not expect: dramatic strength changes quickly, improvement is gradual. Or complete elimination of mobility limitations if you have significant arthritis or other conditions. Exercise 2, mini crunches. The second exercise is the mini crunch, a modified abdominal crunch designed specifically for older adults. Unlike traditional crunches that require significant neck and spine flexion, mini crunches involve minimal movement focused on engaging the abdominal muscles safely. This exercise strengthens your rectus abdominis, the front abdominal muscles, and your obliques, the side abdominal muscles. You'll need a firm, comfortable surface, a yoga mat on the floor, a carpeted floor, or a firm bed. Here's how to perform mini crunches. Lie on your back with your knees bent and feet flat on the floor, hip width apart. Place your hands across your chest or rest them gently behind your head. If behind your head, support your head lightly without pulling on your neck. Gently pull your belly button toward your spine to engage your core. Now, slowly lift just your head and shoulders off the surface. Aim for 2 to 4 inches of lift, no more. Your lower back should remain in contact with the floor. Focus your gaze toward the ceiling to keep your neck neutral. Hold briefly at the top, 1 to 2 seconds, then slowly lower back down with control. That's 1 repetition. Perform 8 to 10 repetitions. Rest for 1 minute, then complete a second set if you feel capable. Practice this 3 to 4 times per week. Key form points: keep the movement small and controlled. You don't need large range of motion. Don't pull on your neck if hands are behind your head. Your abdominals should do the work. Exhale as you lift, inhale as you lower. And move slowly, taking 2 to 3 seconds in each direction. Modifications: if getting on the floor is difficult, you can perform a similar movement seated. Sit tall, place hands across chest, and gently lean back slightly, then return upright, engaging your abs. If full mini crunches are too challenging, simply engage your core by pulling your belly button in and holding for 5 to 10 seconds. This static engagement still strengthens muscles. What this exercise does: it strengthens the front and side abdominal muscles that support your spine, improves your ability to maintain upright posture, and reduces lower back strain by supporting proper spinal alignment. Functionally, this helps with maintaining good posture while sitting and standing, reducing lower back pain from weak abdominals, and supporting breath control and core stability. Safety considerations: mini crunches are generally safe, but avoid or modify if you have severe osteoporosis. Forward flexion can increase fracture risk. Consult your doctor. Recent abdominal surgery: wait for medical clearance. Or significant neck problems: keep hands across chest and move very gently. If you experience sharp back or neck pain, stop and consult a healthcare provider. What to realistically expect: with consistent practice over 6 to 8 weeks, you may notice improved postural awareness and ability to sit upright, reduced lower back discomfort in some cases, and better core control during daily activities. What you should not expect: visible abdominal definition. At this age, functional strength matters more than appearance. Quick fixes for chronic back pain: back pain is complex and may require comprehensive treatment. Or that this single exercise addresses all core weakness. A variety of movements is ideal. Exercise 3, Modified Planks. The third exercise is the modified plank, an adapted version of the standard plank that's much more accessible for older adults while still providing excellent core strengthening benefits. The plank is an isometric exercise, meaning you hold a position rather than moving through repetitions. This challenges your entire core, front, back, and sides, to work together to maintain stability. The key difference in the modified version: you perform it at an incline using a wall, counter, or sturdy furniture rather than on the floor. Here's how to perform a modified plank. Stand facing a kitchen counter, sturdy table, or wall. The higher the surface, the easier the exercise. Start with a counter if you're new to this movement. Place your forearms on the surface, elbows directly under your shoulders. Step your feet back so your body forms a straight line from head to heels. The further back you step, the more challenging it becomes. Start conservatively. Engage your core by gently pulling your belly button toward your spine. Keep your body straight, don't let your hips sag or pike upward. Look down at the surface to keep your neck neutral. Hold this position for 10 to 15 seconds while breathing normally. Rest for 1 minute, then repeat for 2 to 3 sets total. Practice 3 times per week. Key form points: maintain a straight line from head to heels throughout. Keep your core engaged, imagine you're bracing your midsection. Breathe naturally, don't hold your breath. And keep your shoulders down, not hunched toward your ears. Progression: as you build strength over weeks, gradually increase hold time to 20, then 30 seconds. You can also step your feet further back to increase difficulty, or use a lower surface like a sturdy chair to increase the angle. If modified planks are too challenging, you can start with wall planks. Place your hands on a wall at shoulder height, step back slightly, and hold. This is even gentler but still engages your core. What this exercise does: it strengthens your entire core, abdominals, lower back, and sides, simultaneously. It improves postural stability and endurance. And it teaches your body to maintain spinal alignment under load. Functionally, this supports maintaining upright posture for extended periods, stability when reaching or carrying objects, and better balance by strengthening core stabilizers. Safety considerations: modified planks are generally safe when performed at an appropriate height, but approach with caution if you have significant shoulder problems. Consult your physical therapist. Severe lower back pain: start with very brief holds and higher surfaces, or balance issues, ensure you have stable support. If you feel shaking during the hold, that's normal, your muscles are working. But if you experience sharp pain anywhere, stop immediately. What to realistically expect: with practice 3 times per week over 6 to 10 weeks, you may notice better postural endurance, can stand or sit upright longer without fatigue, improved stability during daily tasks, and increased confidence in your core strength. What you should not expect: rapid transformation. Building core endurance takes time. Complete elimination of all back pain: planks help but aren't a cure-all. Or that you'll progress to floor planks: modified versions are perfectly effective. Creating a simple core routine. Here's how to incorporate all 3 exercises into a simple routine. Practice 3 to 4 times per week on non-consecutive days, for example, Monday, Wednesday, Friday, and optionally Saturday or Sunday. Perform the exercises in this order: knee to chest marches, seated 8 to 12 reps per leg, 2 sets. Rest 1 minute between sets. Mini crunches, lying 8 to 10 reps, 2 sets. Rest 1 minute between sets. Modified planks, at counter 10 to 15 second holds, 2 to 3 sets. Rest 1 minute between sets, total time, approximately 15 to 20 minutes per session. Start conservatively with lower repetitions and shorter holds. Gradually increase over weeks as you build strength and confidence. Quality always matters more than quantity. Perform each exercise with proper form. Important context and limitations. These core exercises are valuable for strengthening the muscles that support balance, posture, and daily function. However, they exist within a broader health context. Core exercises alone don't provide cardiovascular fitness. You still need activities like walking. They don't address all aspects of fall prevention. Balance-specific exercises, vision care, medication management, and home safety are also important. They may not be appropriate for everyone without modifications. Individual assessment matters. And they're not miracle solutions. They're effective tools when practiced consistently as part of comprehensive healthy aging. You should consult a physical therapist or healthcare provider before beginning if you have significant pain that limits movement, recent surgery affecting your abdomen, back, or hips, complex medical conditions including severe osteoporosis, or if you're unsure whether these exercises are appropriate for you. Supporting practices. Beyond core exercises, several other factors support overall strength and fall prevention. Continue regular physical activity, walking, daily movement, and general activity remain essential. Core exercises complement but don't replace cardiovascular activity and overall movement. Balance training. Consider adding simple balance exercises like standing on one foot with support, or walking heel to toe along a line while holding a counter. Adequate nutrition. Protein intake supports muscle maintenance. Aim for protein at each meal. Calcium and vitamin D support bone health. Regular vision and hearing checks. Sensory function is critical for balance and fall prevention. Medication review. Some medications affect balance. Discuss any concerns with your healthcare provider. Home safety. remove tripping hazards like loose rugs, ensure adequate lighting, install grab bars in bathrooms if needed. Realistic timeline. Core strength improvements are gradual. Here's a realistic timeline. Weeks 1 to 3, you're learning proper form, building initial neuromuscular connections, possibly experiencing mild muscle soreness, normal. Weeks 4 to 8, exercises feel more natural and controlled, you may notice some functional improvements in posture or daily activities, you can likely increase repetitions or hold time slightly. Months 3 to 6, noticeable improvements in core strength and postural stability, increased confidence in core-dependent movements, ability to perform more challenging variations if desired. Ongoing, maintenance of gains with consistent practice, continued gradual improvements possible, reaching an appropriate strength plateau is normal and healthy. The goal isn't endless progression, it's reaching and maintaining a functional core strength level that supports your daily activities and independence. Conclusion. Core strengthening through exercises like knee-to-chest marches, mini crunches, and modified planks can help maintain the abdominal and back muscle strength important for posture, balance, and functional independence after 60. These aren't dramatic transformations or miracle cures, they're practical, accessible exercises that support one aspect of healthy aging, core stability and strength. Falls are indeed a serious concern for older adults, and maintaining core strength is one important component of fall prevention. However, it's just one component among many, including balance training, proper footwear, home safety, vision care, and more. Thank you for watching. If you have specific concerns about your core strength, balance, or fall risk, consult with a physical therapist or healthcare provider who can assess your individual situation. Consider subscribing for evidence-based guidance on movement and healthy aging, information that's realistic, practical, and grounded in research. Core strength after 60 is achievable with consistent, appropriate practice and realistic expectations.